Hi everyone, here to talk about a really rare condition called spasmodic dysphonia. And for many of you that know RFK in the current government administration, RFK has spasmodic dysphonia. So spasmodic dysphonia is a central nervous system, a neurological dysfunction where the muscles in the vocal cords either slam shut or are weak and open, right? And open too wide, right? So you have muscles in the vocal cords, and just like the muscles in your legs, you know, the muscles that bring your legs together like this, those on the inside of your thighs, those muscles are called adductors, A-D-D-U-C-T-O-R-S, right? And then the muscles on the outside of the thighs that open the legs are called the abductors, A-B-D-U-C-T-O-R, abductor, right? So adductor and abductor. So those are the difference, right? The abductors open, the adductors bring the muscles together. So now that we got that straightened out, the spasmodic dysphonia, there's 3 different types, but most common is type 1, and that's where the adductors, the muscles that slam the vocal cord shut, that's about 85 to 90% of cases. So then we have a patient that has the adductor and also the abductor spasmodic dysphonia. So that's called a mixed spasmodic dysphonia. That's the 3rd type. Okay, so the abductor, the adductor, and the mixed. So we have a patient with the mixed, and we have currently another patient with the more common type 1, or they don't really list them in numbers, but the adductor spasmodic dysphonia. Now, let's get into the science of this, because this is what I love. If you do your own research and you type in spasmodic dysphonia, it'll give you some information about Botox treatments, stuff like that, but it's really management, and it doesn't really work that well, okay? From my experience, from the patients that we see, it doesn't really work that well. So that being said, and it can just manage and make it a little less severe, right? But when you're talking about the adductor type, the vocal cords sound like, the voice sounds like choppy. So the adductor, spasmodic dysphonia, they slam shut and the voice sounds choppy like this, and you can't really say the whole sentence or word it's completely, and I'm not making fun of these people. It's an awful condition, but that's what it sounds like, right? And then you have, of course, the other type, which is the abductor spasmodic dysphonia, and that one is like air being released, like so it suddenly opens, preventing from like vibration and to produce sound. It's this sort of air escapes from the lungs, and another kind of weird vocal change. So, and then the mixed is just very hard. It's hard to speak and you sound like you're whispering, right? Type 2, the abductor type, the voice is more subdued, it's lower, it sounds like people are whispering. So now the treatments. Going into the treatments, Botox is really the only thing, but if you do further investigation online, you'll see photobiomodulation, cold laser therapy. I would use photobiomodulation, that's the scientific name, and you will find some research showing some promising things on spasmodic dysphonia and photobiomodulation affecting the vocal cords right here, right near where the thyroid gland is. It's right next to the thyroid in the trachea, okay? So let's get into a little bit of the neuro supply to those muscles, right? Because when I think of a muscle going into spasm or opening up suddenly, I think, well, what's controlling that muscle? So then we trace back from the vocal cords and we get to the recurrent laryngeal nerve. Now, recurrent laryngeal nerve, we could call it the RLN for short, okay? And the RLN is a branch of, guess what nerve? Such an important nerve in the body. Guess. Can you guys guess? The vagus nerve. Yeah, it's a detour off the vagus nerve to the recurrent laryngeal nerve. We'll get into that in just a second. So you have the, through the base of the skull, through near the basal ganglia, you have the nerve coming down and then it comes down into the chest. Now, the left recurrent, you have two of them, left and right. The left RLN, that one wraps underneath the aortic arch and up and around and comes back up to the vocal cord area. And so the right recurrent laryngeal nerve, or RLN, it goes on the other side. So it's going to loop a little bit higher up under the right subclavian artery. So you can see that there's a direct connection between the recurrent laryngeal nerve, and it could be a compression of that nerve up at the base of the head or neck. So if you've had head trauma or have a lot of neck pain, tension headaches, stuff like that in the back of the head or neck, that could definitely contribute to this, right? Stress, a lot of people say like a stressful moment triggered this, right? So we hear that a lot. So that's something where you want to target. Also, chiropractic care is really effective for cranial nerve supply and just loosening up all the tension in the back of the neck and realigning the spine, restoring proper nerve flow. Also, soft tissue work, but photobiomodulation could be very helpful in the cervical spine and along the side of the vocal cords itself. Now, we trace that recurrent laryngeal nerve down to the vagus nerve. And the vagus nerve, and I talk about the vagus nerve all the time. By the way, if you don't know anything about the vagus nerve, please check this video out, because we've done, this is understanding the vagus nerve, right? So we've done a whole thing on the, I've done 5, 6, 7 videos, maybe 8, 10 on the vagus nerve, but here's one, put up a few more for you guys, but I really want you to check that out. And it's usually under our hiatal hernia playlist, okay? Because a hiatal hernia puts pressure on the vagus nerve, and guess what? A lot of our patients with spasmodic dysphonia, in fact, all of my patients, they'll have acid reflux and GERD, hiatal hernia. So acid can also pour into the throat and irritate the vocal cords, but I don't believe that that's just what it is. I also think the hiatal hernia puts pressure on the vagus nerve right here, right where the hernia happens, and your vagus nerve runs up, and of course, the detour is the recurrent laryngeal nerve. But if there's pressure on the main highway, that little detour is going to be affected too, which is that recurrent laryngeal nerve. So there you go, spasmodic dysphonia, the types of spasmodic dysphonia, and the connection between the recurrent laryngeal nerve and the vagus nerve. Thanks for tuning in, and make sure you check out my other videos. We're doing 4 videos every week. We've got over 1,250 videos. Check out our playlists on hiatal hernia, costochondritis, shoulder, back problems, you name it, anything healthcare related, even product reviews. Thank you. Appreciate you. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.